Hi micro students, I'm going to talk about chemical means of control in this section, specifically some substances that are used as antiseptics and disinfectants. You can follow along on your outline and kind of take some notes down while I discuss these topics with you. All right, so first of all, let's begin by discussing a substance called phenol. Now, Joseph Lister used phenol back when he was making some groundbreaking strides in medicine. It was called carbolic acid at that time. Maybe you'll recall that from the history of microbiology segment that you studied earlier this semester. And what Lister did was he soaked surgical dressings in phenol or carbolic acid and applied them to the surgical wound, and his patients actually started to survive surgery. So this was a big breakthrough in medicine. Now, phenol is not used very broadly anymore. A couple of reasons. One, when used as an antiseptic, it's actually very irritating to living tissue. And two, it smells very bad. Perhaps you'll recall when we did acid fast staining and you had to steam the slides and you were adding the stain called carbofuscin as you were steaming. Well, that very medicinal smell was actually phenol, so I think you can appreciate the bad odor. Now, phenol is a very effective antimicrobial substance. Its action is that it disrupts plasma membranes and denatures enzymes, rendering them non-functional. And it is still used in very low concentrations in some disinfectants and in even lower concentrations in some preparations such as medicinal mouthwashes. Now, because phenol is so irritating, they have altered some of the qualities of phenol in the laboratory and produced what are called phenolics, and phenolics are chemical derivatives of phenol. Now, they act in the same manner. The phenolics disrupt plasma membranes and denature enzymes as well, but they are not as irritating to living tissue and they don't smell quite so bad. Even having said that, phenolics are generally used as a disinfectant rather than an antiseptic. They're very effective for disinfecting surfaces and equipment that have been contaminated with bodily products like saliva and pus and feces. All right, let's move on to the halogens. And these substances act by the inhibition of protein function. And I've got three examples that I wanted to mention this morning. First of all is iodine. Iodine is very useful. It's used as both an antiseptic and a disinfectant. It is effective against many bacteria and their endospores, and also a broad variety of fungi and some viruses as well. Now, I believe I said this, iodine can be used as an antiseptic or as a disinfectant. As a disinfectant, it might be used to disinfect water or as an aerosol to disinfect air. As an antiseptic, it could be applied to the skin as a topical. And chlorine would be our next example. It can be used either as a gas or it can be compressed into a liquid form. Chlorine has traditionally been used to disinfect swimming pool water, for example. I think that's largely been replaced by reverse osmosis, but it still is a very effective way to disinfect swimming pools. It can also be used in a form called sodium hypochlorite, and that's just the chemical name for household bleach, very effective disinfectant in the household. And it is in addition to being a halogen and inhibiting protein function, chlorine is a very strong oxidizer as well. Fluorine is used either alone or in combination with chlorine, primarily to disinfect municipal water supplies. I'm referring to reservoirs. And fluorine also has some qualities that make it good for our health as far as preserving the hardness of the enamel of our teeth. And so there's another reason to add fluorine to the water supply. All right, let's move on to alcohols. The manner in which alcohols act is that they denature proteins and they dissolve lipids. And the alcohols will kill many bacteria and fungi, but they're not especially effective against viruses or endospores. Now, pure alcohol, its concentration is 95%. And the alcohol that we buy, for example, in the drugstore, it's been diluted to 70%, diluted with water. Now, this may sound a bit curious, but 70% alcohol is actually a more effective antimicrobial substance than pure alcohol. The reason for that is this. The addition of the water to the 95% alcohol, bringing it down to 70% concentration, allows the alcohol to be more effectively absorbed into cells, where it can cause that damage to the cells, most especially gram-negative bacteria, because they have that outer membrane portion of their cell wall, which is largely lipid in nature. Alcohol is used as an antiseptic, and it may be used as a disinfectant in some situations. Okay, I'm moving on to ethylene oxide. The manner in which this chemical works is by denaturing proteins, and it is extremely effective. It kills all microbes, viruses, endospores, bacteria, fungi. It is exceptionally toxic. It has some other qualities, though, that make it difficult to work with. One is that ethylene oxide is highly explosive. Now, if it is used, it's used in a sealed chamber called a gaseous chemosterilizer. And what we do is we package up whatever it is that we want to sterilize in this manner. It could be paper-wrapped instruments, medical instruments. It could be Band-Aids or sterile gauze that you buy in the drugstore. And then those items are placed inside the gaseous chemosterilizer and exposed to ethylene oxide. The exposure is going to last somewhere between 4 and 18 hours, and the length of exposure is going to depend upon the size and the density of the item that we want to sterilize. Now, because ethylene oxide is so explosive, it's going to be mixed with some inert gas, meaning non-reactive, and that could be carbon dioxide or that could be nitrogen, and that just reduces the risk of explosion. Ethylene oxide is very effective at penetrating multiple barriers. So let's say we were in a manufacturing plant where they're producing sterile Band-Aids. So the Band-Aid would be manufactured, and then that would be wrapped in a paper wrapper, placed in a cardboard box, wrapped with an additional layer of plastic, and then packed up into cartons. And then that carton would actually get placed in the gaseous chemosterilizer, and the ethylene oxide would penetrate all of those layers and sterilize the Band-Aid, and then it would evaporate away. Now, ethylene oxide is not so much in favor anymore. It used to be pretty much every hospital had a gaseous chemosterilizer. But when the run is complete, the ethylene oxide has to be vented into the environment. And I'm sure you can imagine that there were many people that had concerns about environmental issues. So not used so much anymore, mostly in manufacturing situations and not so much in hospitals. All right, oxidizing agents are next, and they literally oxidize cellular components. A couple of examples would include ozone, which is the chemical formula would be O3, and hydrogen peroxide, H2O2. Now, ozone may be used to disinfect air in a room, for example. It could be bubbled through water to do some disinfecting of water. Hydrogen peroxide is commonly used as an antiseptic. Some people like to use hydrogen peroxide to clean an open wound, one that doesn't require stitches, for example. And I think people think that hydrogen peroxide must be good because of that really cool bubbling action that happens when you pour it on your wound. But in fact, what's bubbling are your cells that are being oxidized and killed by the hydrogen peroxide. So in my opinion, hydrogen peroxide has limited usefulness on open wounds. You'll be better off using just plain old soap and lots of water. A more serious wound, of course, would require medical attention. Hydrogen peroxide does have some other uses, for example, as a mouthwash after dental surgery, but I don't think it's as effective as many people believe that it is. All right, next category are surface active agents, also called surfactants. In this category, we have our soaps and detergents. Now, I'm just talking about plain old soap, not antimicrobial soap. And while soap does not have much in the way of antimicrobial action, here's what it does for us. when we wash our hands. We add soap, we add some water, and then we start to scrub our hands, right? And that mechanical rubbing is very important, because what it does is it helps loosen oils and dirt and any microorganisms that might be on your skin. The soap emulsifies oils on your skin, whether they're natural or you've acquired them in some task. And by emulsifying, I mean allows the oil to mix with water and more readily be washed away from your hands. So scrubbing is very important. The soap is emulsifying the oils, helping to lift the dirt and other debris. And then when you wash your hands, all of that material is going to be rinsed from your skin. Also in this category is a substance that has a very specific use, or I should say a category of substances. They're called acid anionic sanitizers. They are used primarily in dairies. And as you might imagine, there's going to be a high fat content associated with the products in a dairy, milk and cream and butters and so forth. And acid anionic sanitizers are very good at emulsifying those oils, and they may be used to disinfect surfaces and equipment in the dairy industry. All right, let's move on to the quaternary ammonium compounds, also called the quats. They're used for cleaning, for example, in hospital situations, and they are strongly bactericidal against gram-positive bacteria, also effective against many fungi, amoebas like entamoeba, and viruses, but not especially effective against gram-negative bacteria. So here's a situation where you need to have some knowledge of what type of microorganism it is that you're trying to destroy. Now, the chemical mode of action for the quats is uncertain, but researchers believe that it may be a disruption of the plasma membrane, so possibly dissolving of the lipid portion of that type of cell wall. All right, and then the last category I wanted to discuss are the aldehydes. Now, the aldehydes inactivate proteins and make them non-functional, and they are among the most effective antimicrobial agents. I've got two examples I wanted to mention. First of all is formaldehyde, and then I'll also talk for a moment about glutaraldehyde. Now, formaldehyde is the gas form of that substance, and when it is dissolved in water, they refer to it as formalin. The most typical concentration would be a 37% aqueous solution of formalin. So that means that formalin has been dissolved in water until a 37% concentration has been achieved. And this is a very effective antimicrobial substance. Traditionally, it was used to preserve biological specimens, but there are many health risks associated with it, respiratory risks. It's also a potential carcinogen, and for the most part, formalin and formaldehyde have been phased out of the use of most laboratory situations. Glutaraldehyde, on the other hand, is even a more effective antimicrobial substance, and it doesn't carry with it the health concerns that formalin does. It's often used to sterilize hospital equipment. Most typically, what will be used is a 2% solution referred to as Cidex, C-I-D-E-X. And respiratory equipment is commonly sterilized this way or disinfected. And if you soak the equipment in a 2% Cidex solution for 10 minutes, that will kill most bacteria. But if you increase the length of the exposure, the soak, up to 30 minutes, that will even kill Mycobacterium tuberculosis. All right, that wraps up this segment. Thanks for listening, and I'll see you soon.